According to the World Health Organization, today more than 55 million people live with some form of dementia, and nearly 10 million new cases are diagnosed every year. But the most alarming figure concerns older adults. After the age of 60, the risk of developing Alzheimer's or other dementias grows exponentially, and recent studies have uncovered a hidden factor many people overlook. Some common medications can triple this risk. We are not talking about rare or experimental substances, but about pills that millions of people take every day for anxiety, insomnia, chronic pain, allergies, or digestive problems. Research conducted by the University of Washington on over 3,400 patients showed that those who used certain categories of medications for a prolonged period had up to a 300% higher chance of developing cognitive disorders compared to those who did not take them. Numbers that cannot be ignored. The human brain, especially after age 60, becomes more vulnerable to chemical imbalances and microscopic damage that accumulates slowly over time. Many older adults believe that a small pill to sleep better or calm anxiety is harmless, but scientific evidence tells a different story. Certain active ingredients can disrupt communication between neurons, reduce the production of vital neurotransmitters such as acetylcholine, and even promote inflammatory processes. Over time, this wears down brain functions to the point of compromising memory, attention, and reasoning ability. It's not necessary to have immediate symptoms to be at risk. Often decline begins silently, with small signs that go unnoticed: slight difficulty concentrating, unusual mental fatigue, temporary confusion about dates or appointments. Many attribute these issues to aging, but in reality, they may be warning signs of medication-related damage progressing without being recognized. Being informed is the first step toward protection. Knowing which categories of drugs are involved makes it possible to discuss safer alternatives or strategies with your doctor to reduce risks without stopping essential treatments. In the next few minutes, we will see how these medications act on the brain and why they represent a silent threat, often underestimated even by long-term users. When we take a medication, we almost always think about the organ we want to treat: the stomach, the joints, the prostate, the lungs. But we rarely imagine that the same molecule could reach the brain. Yet the blood-brain barrier, the system meant to protect the nervous system from harmful substances, is not invincible. With age it becomes more permeable, allowing chemical compounds to pass through that would previously have been blocked. Some medications, especially when used long-term, disrupt the delicate balance of neurotransmitters. A key example is acetylcholine, essential for memory, attention, and learning. Several active substances work precisely by reducing its availability. This calms symptoms like anxiety or insomnia but deprives neurons of a crucial messenger. Over time, this can slow down brain communication and pave the way for cognitive decline. Other drugs induce a sort of mental fog by interfering with the circuits that control alertness and responsiveness. Studies on older patients have found that continuous use of certain molecules causes daytime drowsiness, slower reflexes, and micro-confusions that gradually worsen, eventually becoming more serious deficits. These early effects are often ignored or mistaken for normal signs of aging. Another critical mechanism is chronic inflammation. Some active ingredients, especially when combined with other medications, can trigger subtle inflammatory processes in brain tissue. This low-grade inflammation slowly damages the connections between nerve cells and reduces the brain's ability to repair itself. The result doesn't appear in a few days, but after months or years. Memory problems, disorientation, mood decline, and in severe cases, full-blown dementia. An additional risk is excessive sedation. When a medication depresses the central nervous system to induce relaxation or sleep, it can also alter the deep stages of nighttime rest, which are essential for consolidating memory. Sleeping under the influence is not the same as restorative sleep. On the contrary, it leads to fragmented rest and reduced clearance of metabolic waste, substances whose buildup is linked to the formation of amyloid plaques typical of Alzheimer's. Finally, polypharmacy, taking multiple medications at the same time, amplifies all these risks. Interactions between different molecules can multiply side effects and slow brain metabolism, creating a potentially devastating combination for already vulnerable neurons. Not surprisingly, people who take more than 5 medications a day statistically have a much higher likelihood of developing cognitive deficits than those who take few or none. Knowing that these mechanisms exist is not meant to cause fear, but to empower informed choices. In the next few minutes, we'll look at which categories of medication science has identified as most harmful to brain health. Understanding them is the first step to discussing safer alternatives with your doctor. Among the medications most studied in relation to cognitive decline are benzodiazepines, substances prescribed for decades for anxiety, insomnia, muscle spasms, and various other disorders. Names like diazepam, lorazepam, alprazolam, bromazepam, or temazepam often appear on prescriptions for those over 60. Many consider them harmless aids to sleep better or feel less nervous, but scientific literature is issuing increasingly strong warnings. These drugs work by enhancing a neurotransmitter called GABA, which reduces neuronal activity and induces calm and sleep. The problem arises when use becomes chronic. The brain, accustomed to a constant inhibitory signal, gradually loses its ability to maintain flexible and responsive connections. Long-term studies show that using these drugs for more than 3 months is associated with a significant increase in the risk of developing Alzheimer's and other forms of dementia, especially with high doses or daily use. Beyond direct damage to cognitive circuits, benzodiazepines have side effects that indirectly harm brain health. Daytime drowsiness, slowed reflexes, falls, and head injuries are much more frequent among older adults who take them. Each fall resulting in concussion or microbleeds adds another risk factor for cognitive decline. Another issue is dependence. Over time, the body builds tolerance, requiring higher doses to achieve the same sedative effect. When someone tries to stop the medication, withdrawal symptoms such as agitation, insomnia, and confusion can appear, making it difficult to discontinue without medical support. This traps many older adults in a cycle of long-term use that heightens the dangers to memory and mental function. It's important to clarify that not everyone who has taken benzodiazepines will develop dementia, but the data consistently shows a significantly higher risk compared to those who don't use them. For this reason, many specialists now recommend limiting therapy duration, using these drugs only for short periods and under close medical supervision. Those already taking them should never stop abruptly. Doing so can be dangerous. It's essential to consult one's primary care physician or a specialist in geriatrics or neurology. There are gradual tapering strategies, non-drug alternatives for insomnia, such as sleep hygiene and cognitive behavioral therapy, and newer medications with safer profiles. Understanding the mechanisms and risks of this first category is the initial step to protecting the mind. But benzodiazepines aren't the only ones under scrutiny. Other substances, often used for everyday issues like allergies or incontinence, have an even subtler impact on the neurotransmitters linked to memory. If benzodiazepines are familiar to many, anticholinergics act in an even quieter way. This is a large family of drugs that block the action of acetylcholine, a neurotransmitter essential for memory, learning, and alertness. Unfortunately, these molecules are found in many medications that seem harmless and that many older adults have been taking for years without suspecting any risk. Among the most common anticholinergics are products for allergies and colds, first-generation antihistamines such as diphenhydramine and chlorpheniramine, medications for urinary incontinence, oxybutynin, tolterodine, remedies for nausea and motion sickness, scopolamine, meclizine, certain sleep drops sold as mild sedatives, and even some gastrointestinal medications. The problem is not occasional use, but prolonged or combined use of multiple anticholinergic products. Several studies have confirmed the link between cumulative anticholinergic load and cognitive decline. Research conducted by the University of Washington on more than 3,400 people over the age of 65 showed that those who had taken high cumulative doses of these drugs for more than 3 years had up to a 54% increased risk of dementia compared to those who had not taken them. And this was independent of other factors such as hypertension or diabetes. The mechanism is relatively straightforward. Without acetylcholine, neurons in the hippocampus, the area crucial for consolidating memories, communicate less effectively and become more easily damaged. Over time, this deficit can become permanent, leading to problems with attention, difficulty remembering new information, and, in more severe cases, Alzheimer's disease. The greatest danger is that many patients are unaware they are accumulating anticholinergics. For example, someone taking an antihistamine to sleep, a medication for overactive bladder, and occasionally an anti-nausea drug is stacking effects that together become toxic to the brain. Even some over-the-counter medications considered mild have anticholinergic properties and are used without consulting a doctor. How can the risk be reduced? First of all, do not stop anything on your own, but request a full review of your prescriptions. Today, there are tools such as the ACB, Anticholinergic Cognitive Burden Scale, that help doctors evaluate the total load of these active ingredients and suggest alternatives with less impact on the mind. For allergies, insomnia, or overactive bladder, there are newer medications that do not easily cross the blood-brain barrier, making them safer for older adults. Knowing that behind common remedies there can be a memory enemy effect is a first step toward changing habits and protecting cognitive function. And while anticholinergics affect the brain by blocking neurotransmitters, other substances influence it more indirectly, interfering with metabolism and cerebral circulation, elements vital to keeping the mind young. Another group of medications that deserves attention includes statins and certain tricyclic antidepressants. Statins are prescribed to millions of people over the age of 60 to lower cholesterol and protect the heart and arteries. Tricyclic antidepressants, on the other hand, are used for mood disorders, chronic pain, or resistant insomnia. Although useful in many cases, their impact on the aging brain is the subject of ongoing debate. Statins work by lowering cholesterol levels, but cholesterol is not only an enemy. In the nervous system, it is a fundamental component of cell membranes and synapses. Some observational studies have suggested that excessive reduction could alter the stability of neuronal connections and impair the production of hormones and vitamin D, elements important for brain health. Other studies have not confirmed a direct risk but agree that very high doses and long-term treatments require close monitoring, especially in frail older adults, where side effects such as fatigue, muscle pain, and drowsiness can worsen alertness and mobility, indirect factors in cognitive decline. Tricyclic antidepressants, such as amitriptyline, nortriptyline, imipramine, represent another potential threat when used long-term. They have a strong anticholinergic effect, already discussed in the previous chapter, and can cause dry mouth, constipation, drowsiness, but also mental confusion and loss of focus. In older patients, the sum of these effects can mimic or accelerate cognitive deterioration. A critical issue is that these drugs are often continued for years without periodic reassessment because they work, and no one thinks about stopping or replacing them. But as we age, metabolism slows down. The liver and kidneys eliminate drugs more slowly, and the brain becomes more sensitive. This means that the same dose well tolerated at 50 can be too high at 70 or 80. This is not about demonizing statins or antidepressants. In many cases, they save lives and improve quality of life. The real message is to personalize and regularly update therapies. For cholesterol, there are newer generation molecules and the possibility to adjust doses. For depression or neuropathic pain, there are more selective alternatives with less impact on memory and alertness. A practical step is to schedule an annual medication review with your doctor, bringing an up-to-date list of everything you take. Discuss any side effects, fatigue, confusion, memory lapses, and ask if there are lighter options. Often, simply changing the drug or slightly reducing the dose can relieve pressure on the brain without losing therapeutic benefits. Understanding these risks helps avoid the common mistake of thinking, if my doctor prescribed it once, it's fine forever. But there's one last category that acts even more stealthily, disrupting sleep and the brain's repair processes: modern hypnotics and corticosteroids. In recent decades, hypnotic drugs considered safer than older benzodiazepines, such as zolpidem, Zaloplan, and esopicolone, have appeared on the market. Many doctors prescribe them to people suffering from chronic insomnia because they work quickly and, in theory, with fewer side effects. However, long-term studies are revealing that these compounds are not entirely harmless to the aging brain. The sleep induced by these hypnotics is not identical to natural sleep. It reduces the deep stages, NREM3 and REM, during which the brain consolidates memories, repairs synaptic connections, and clears toxins accumulated during the day. Prolonged use can therefore interfere with these brain maintenance processes, promoting a progressive cognitive slowdown. In addition, the next day many patients report drowsiness, reduced attention, and a higher risk of falls, which can lead to head injuries, further accelerating decline. Another group to watch closely are corticosteroids, prednisone, dexamethasone, methylprednisolone, used to treat chronic inflammation, autoimmune diseases, and flare-ups of respiratory problems. Powerful and often essential, these drugs can nonetheless disrupt stress hormone balance and neuronal plasticity when taken for long periods or at high doses. Side effects such as mood swings, irritability, anxiety, and difficulty concentrating are common and, in predisposed individuals, can pave the way for more serious cognitive disorders. The danger increases when hypnotics and corticosteroids are combined with other drugs already discussed: anticholinergics, tricyclic antidepressants, and statins. The cumulative effect can be devastating for memory and mental clarity. Many older adults end up taking a sleeping pill, an allergy antihistamine, and a cortisone-based anti-inflammatory at the same time, without anyone assessing the overall burden on the brain. How can risk be reduced without compromising necessary therapies? In the case of hypnotics, patients can ask their doctor to consider as-needed use instead of daily use and combine it with good sleep hygiene techniques. A regular routine, exposure to natural light in the morning, avoiding caffeine and screens at night. For those who need corticosteroids, strategies can be explored to reduce cumulative doses, alternate shorter cycles, or use more targeted drugs with less penetration into the brain. A valuable tip is to keep a precise record of the duration and dosage of treatments. Many people do not remember how long they have been taking a sleeping pill or a temporary steroid that then became permanent. Bringing this log to the doctor helps evaluate risks and alternatives. Understanding that even newer generation drugs can harm the brain if misused is an essential step. And the risk grows exponentially when multiple medications are taken without regular review. The phenomenon of polypharmacy, often underestimated, deserves urgent attention. As we age, it's common to accumulate prescriptions. One medication for blood pressure, one for cholesterol, one for sleep, an analgesic for chronic pain, perhaps a seasonal antihistamine. This accumulation, called polypharmacy, is now one of the main threats to brain health. According to European studies, more than 40% of people over 65 take at least 5 different medications every day, and about 12% take more than 10. The problem is not only the quantity but also the unpredictable interactions. Drugs that seem safe individually can combine and amplify side effects such as sedation, confusion, and cognitive slowing. Each new prescription increases complexity and the risk that the doctor lacks a complete overview, especially when medications come from different specialists. Self-medication makes the situation worse. Many people buy over-the-counter products without consulting anyone. Antihistamines, to sleep better, painkillers, supplements with neuroactive effects, unaware that they may add up to existing therapies. Even natural remedies can interfere with metabolism and increase sedation or drowsiness. The result is a chemical load that the aging brain struggles to handle. Often the first signs are subtle: disorientation after a cold treated with cough syrup, slower memory during anti-inflammatory therapy, loss of balance. Unfortunately, these symptoms are often labeled as normal aging and ignored, allowing damage to progress. A key step is always carrying a complete, up-to-date list of everything you take, including supplements and over-the-counter drugs, and showing it to every new doctor. Requesting periodic medication reviews reduces the risk of overlapping effects and helps identify safer alternatives for the brain. Awareness and collaboration with healthcare professionals can break this cycle and prevent irreversible damage to memory. And to provide concrete tools, the next step is to understand what we can do today to protect our cognitive functions and reduce damage already underway. The first concrete decision is never to stop medications on your own, but to talk to your trusted doctor. Bringing an up-to-date list of all medicines you take, including over-the-counter drugs and supplements, allows the professional to assess the total load on the brain and suggest possible adjustments. Even simply replacing an old sedative with a newer generation one or gradually reducing the dose of an anticholinergic can improve clarity and alertness. Scheduling an annual review of your therapies is another simple and effective strategy. During this visit, it's possible to discuss alternatives with less cognitive impact, evaluate side effects, and check whether the dose is still appropriate for your age and health condition. This prevents treatments that were initially useful from becoming, over time, a silent risk factor. At the same time, acting on lifestyle greatly strengthens brain protection. Maintaining regular physical activity improves circulation and promotes the creation of new neural connections. Following a diet rich in antioxidants, healthy fats, and B vitamins supports brain metabolism. Sleeping naturally and deeply allows the brain to repair itself and clear accumulated toxins. Stimulating the mind with reading, learning new skills, or engaging in thoughtful conversations also reinforces cognitive reserve. Finally, cultivate awareness and personal monitoring. Pay attention to changes in memory, mood, and concentration. Small warning signs shouldn't be ignored but shared with doctors and family. Detecting a problem early makes it easier to reverse or slow cognitive decline. Being informed, asking questions, and not silently accepting every prescription are powerful actions. The brain can be protected even after years of treatments. Reducing the load of risky drugs and strengthening healthy lifestyle habits means maintaining autonomy, mental clarity, and quality of life for longer.